This is my first ever YouTube video, and I'd like to say hello. And if you follow me on TikTok and followed me over, thank you so much. I greatly appreciate you. Please subscribe to my YouTube channel. This is new for me. So I'm going to start a new YouTube channel because I thought maybe I have some good advice in regards to all the experience I have in regards to being a chronically ill patient, but also being a nurse and now transitioning into being a nurse practitioner. So I'm going to start a YouTube channel maybe to just tell you about my life, maybe give you some different tips and everything. So I first wanted to start by introducing myself. I thought that was a great way to maybe get to know each other, or maybe you can, if you don't know me from TikTok. So first, I'd like to say hi, my name is Ariel. So I grew up in Lincoln, Rhode Island. I live in the Providence area. I am one of 4. I'm also an identical twin. So if you see me out, just have to think that it may not be me, it could be my twin sister, okay? I also have an older sister and a younger brother. I went to high school, and after that, I graduated. I went to Rhode Island College. My identical twin sister is the reason that I am a nurse, because she's like, well, I want to be a nurse, so why don't you come be a nurse with me? So that's why I am a nurse, is because of my twin. So one of the main reasons I want to start a YouTube channel is to raise awareness and spread knowledge, because knowledge is power. And I do believe I was just fired from my job because I was just trying to educate about something. And I believe that the universe is telling me that maybe I should be out there educating more people. And that's why maybe starting a YouTube channel to give more people some confidence of becoming a nurse. I do have great experience being at the bedside over the past 10 years, and I've learned some great tricks as being an oncology nurse. And also, as being a nurse, it has translated into being a better patient, or not being a better patient, or being able to take better care of myself. So I'd like to start this channel to maybe just give more knowledge to others, make you guys feel less alone, because sometimes when you're really sick, it's really hard to see anything else. So I hope that through my channel that we can spread positivity, and I can also encourage and empower. I want to empower other patients, other nurses, or anyone that is watching me. I want to empower you and make you feel better, if anything. I always like to say that my intentions, I'm never going in with starting a video with ill intention. I want that my channel to be a safe place for learning and to educate others and empower them to take care of the best self. So please, thank you for following me, and I truly appreciate any subscriptions and love that I receive and any comments. So the disease that I have is hereditary angioedema. Although I did not receive it from either of my parents. It was a genetic mutation when my twin and I split in the womb. That's what I was told. So, which is a 20% chance that can actually happen with this disease. So what is hereditary angioedema? So angioedema is swelling of the tissue, okay? So where I get most of my swelling is abdominal swelling. I am very large and in charge right now. My stomach is actually very flat, but what happens is I get these random bouts of swelling. So with this disease, you have these unpredictable, debilitating bouts of swelling that you can have triggers, but sometimes it can be unprovoked. Where are the areas that you can get swelling? Mine, I get my most swelling in abdominal swelling. So it's like my intestines are swelling, and it's extremely painful. It can cause, the symptoms are nausea, vomiting, and diarrhea, and also severe abdominal pain. Next, you can also have throat swelling. Throat swelling, I develop those quite frequently. And what is happening is I am swelling around the tissue on the outside of my throat. And what larynx is, laryngeal swelling is the real name. And what happened is the swelling is pushing on my voice box. And that's what's causing my voice to get higher and higher and higher pitch. And I sound like a chipmunk. So the reason why is because it's restricting my airway. There is a 30% mortality rate with no treatment for laryngeal edema because it can be death caused by asphyxiation or like suffocation. So that is why I take my medication with me everywhere. So next, you can also have swelling of your hands, face, eyelids, lip, feet, genitals, you name it. Any place that there is a tissue, it can swell anywhere. It can swell. There are triggers. For example, women. One trigger, especially for women, is when they have their menstrual cycle. Dental procedures, any type of manipulation in your mouth, infection, colds, things like that can actually trigger. Another one is emotional stress. That's me. Emotional stress will actually make me very sick and make me flare. Although I try to control that, but it's very difficult. So trying to stay away from my triggers is the most important thing to prevent me from continuing to being sick. So with my disease, it's an autosomal dominant trait, okay? So one of the parents have to have it, and there is a 50% chance of the offspring having it. So if I ever have a child, there's a 50% I will pass it on to my child. Once the genetic mutation happens, it's in my DNA. So when I have it, I can pass it on to my child. In the regards to the rules of pregnancy, can I have a child? Yes. Would it be difficult to me? Probably, yeah. Can I get pregnant? Yes. So how is pregnancy for patients with hereditary angioedema? It can actually is a rule of the threes. So 1/3 of the patients stay the same. No changes to the amount of attacks that they're having. And then there's some patients who actually get better and their attacks decrease while they're pregnant. And then there's other patients who attacks get worse and they're exacerbated while pregnant. I'm feeling like that would be me. Although, I digress. So there are chances that you can have children. But you can also, there's a chance that your child's 50-50, that you will have it or will not have it. They encourage testing your child 1 year after they are born. Testing them right in the beginning may not be beneficial because it may not show. Also, other things is about pregnancy is that people think I'm pregnant all the time because I look it. Although I'm not, but they ask me, people be like, are you pregnant? Or is it a boy or is it a girl? And I just go along with it. Her name is Haley. Okay, get it? Because my disease is hereditary angioedema. The acronym for it is HAE. My last name is Lee, L-E-E. So you get it? Haley. Haelee. That's how we spell her. Haley. I depend on my due date depending on how much swelling I'm in. If I'm big and I am chunky, then I am, then I'm feeling like a 6 month, 7 month. But sometimes when I'm a little bloated, then I'm 3 months pregnant. I don't go and tell people I'm pregnant. Do people ask if I'm pregnant? And I just agree. Because it's better than making them feel uncomfortable, right? Right? I don't know. Anyways, so a little bit more about me is I have a Australian cattle dog, blue heeler. His name's Mo. He's a rescue. And I absolutely love him. He is my biggest companion. He's also my service dog. He does alert me when I'm getting sick or when I'm about to get sick. He actually wakes me up when I'm sleeping to tell me I'm getting sick. I have no idea how he knows, but he knows. So after that, then I got him service dog training. I have to say I love him. That was one thing I have to say is my biggest hobby or things that I love to do is taking him out for walks, bringing him everywhere. He's really important to me. Other things that are really important is spending time with my family. I am very close with my father and my sisters. I'm so close. I love them. If any time I can spend with them, that's exactly what I want to do and what I want to be. Other things that I like is I like coffee, lots of coffee. I like being adventurous, spontaneous. Whenever I feel good, I want to go out and enjoy every day again, because let me tell you, I know that it can change at any moment. So I try to take it day by day. And if there's any encouraging words that you have for me for starting a new channel on YouTube, I would love for some recommendations. DM me or give me some recommendations on how to do this whole YouTube channel since I'm new to it. And I just want to say I appreciate every single one of you that support me. And I may not know you personally, but I have to say that I appreciate all your kind words and comments, and I try to read as much as I can because I truly, truly appreciate every single one of you. So I'd like to tell you a little bit more about my credentials and my experience of it being a nurse and now transitioning to being a nurse practitioner. So first I'd like to start, I graduated in 2013 from Rhode Island College. I graduated my bachelor's in science of nursing, and I also have a minor in psychology. After being at the bedside for multiple years, I went back to nurse practitioner school. I just graduated in April of 2022 with my master's in science of nursing. I am also a board certified adult gerontological acute care nurse practitioner. I am also a certified oncology nurse, so that means that I took a special test saying that I am certified all about oncology. I also completed my thesis on oral chemotherapy adherence, as I think it's so important as this is the new type of treatment. So I would have to say I got some new initials after my name, and I would say I worked really hard for them. But the most important thing is I worked hard because I want to best serve my patients. I want to be the best educated nurse that I can be to best serve my patients. And I'm really excited to transition into my new field as the nurse practitioner now, as a new role. And I'm just so, if I inspire one person, then that's all that matters. If I make one person smile during the day, that's all that matters. And I just hope that I can make you feel warm and fuzzy on the insides and make you laugh and can make you learn and can make you learn how to best advocate for yourself. And that is what my goal is going to be for my YouTube channel. I'm going to speak it into existence as this is my first video, and it's going to be great. And it's going to be great because I have wonderful people like you all following me. So I believe in myself because you are always encouraging me. So thank you.